Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about partnering for preparedness. Our special guest is Melissa Paulus with the Frederick County Health Department's Public Health Preparedness Division. Melissa, welcome and thank you for joining us.
Hi, thank you for having me.
Yeah, well, so our theme, or what we'll be talking about, is partnering for preparedness. So why do you need partners?
It's very important to the health department to build partnerships. One of our key strategies to our strategic plan is actually to forge community collaboration. It's very important to us. I would say all the divisions of the health department work with the community in partnerships in many ways. Those partnerships really are the core to public health. And as far as preparedness, it's essential to what we do. If we did not have our partners in the community, we would not be able to plan and respond for emergencies.
Mm-hmm. Well, that all makes sense. So I see you in many meetings and know that you go to many more. Are health and medical agencies, organizations, are they your primary partners?
Yes, I would say we have many meetings with the people you would expect to see us meeting with, the hospitals, Red Cross often, also with doctors' offices. We also have several meetings with other partners in the county, such as law enforcement, the Sheriff's Office, Frederick City Police. We also meet with the local emergency management office. We're very involved with them. We also meet with public schools. We help partner with them in many occasions, and also Mental Health Association and 211. They partner with us on many responses as well.
All right. Well, so that's already a pretty long list. Are there some additional folks or groups that you partner with that you think might surprise others to know about?
We actually were very fortunate recently. We were in an exercise with other county partners involving Maryland Transit Authority and also Mark Train. So that was an interesting partnership. We also have worked in the past with local real estate agents who have helped us develop and figure out a process for how we would find other facilities or buildings if we needed to open a clinic in an emergency. Local churches are also very helpful and have donated to us their building space to do clinics in the past.
Mm-hmm. And so, while your efforts, I imagine, are really focused on Frederick County and Frederick County's preparedness, do you partner with folks outside of Frederick County as well?
We do. We focus a lot on our local partners, as those members would be the people that we would be on the front lines with when we're responding to an emergency. But we have noticed and know for a fact that in an emergency, it's very likely that our partners' resources would be tasked as well. So we do partner with other nearby jurisdictions that could help us with their resources or their skills during an emergency. We're currently part of a local healthcare coalition, which is regional, and that coalition we partner with Washington County, Garrett County, and Allegheny County, and we do many drills and have meetings with them. Much of what we focus on with those partners is communication and how we would communicate with them if something arises.
Mm-hmm. And so what are some of the things that you do with your partners, I guess, even when there isn't necessarily something that you're responding to, but a lot about this is planning and preparing?
We do a lot of planning. So in that aspect, we write these partners into our plan. We include them specifically and let them know what our expectation might be. And then we exercise with them or drill with them and meet with them. So all of those times that we touch base with those partners, it's a face-to-face contact, so we know who we might need to call in an emergency or who that person can lead us to if we needed a specific resource or a skill.
Okay. Are there some new partnerships that you're looking to develop or enhance in the next year or so?
Yes, we are always looking for new partnerships. It's, again, a part of the core to public health is working with the community. So this year and next year coming, we expect to start working with urgent care centers. We'd like to figure out how we can help them and how they could help us and develop plans and responses for different types of emergencies and what their role might be.
Okay, all right. Well, do you have any lessons learned that you'd like to share with folks from your partnering experience?
I think it's very important to say that Frederick County is very lucky. They have a very strong community partnership It has been noted from the state. It also has been noted by other evaluators that have come and looked at our program specifically. And those partnerships, it's very clear that Frederick County, there's never a time when somebody won't help somebody else. So those partnerships that have been developed, I think that strong sense of community is very apparent. And in that, it has made responding and planning much easier. So I would say on an individual level, if you know your neighbors or have reached out to them, it's important to see who's around you and how you could help each other in a time of crisis, or homebound neighbors who might, or the elderly who might need some assistance should something happen. So I would say start developing those relationships now and know who they are and their face and what people's needs might be.
Well, that all sounds great. So now I know why you wanted to talk about partnering for preparedness, because it's a lot of what you do. Is there anything else that you'd like to share before we close today?
I think it, again, very important to say that we are very lucky, and it's a group effort, and we could not do what we do without our partners here in this community, and we're very thankful to have such a strong community.
Well, very good. Well, thank you very much for being a guest today, Melissa.
Thank you.
And now please stay tuned for this month's Medical Myths.
The Frederick County Department of Housing administers housing rehab programs to assist homeowners in upgrading their properties, bringing homes up to code, and making handicap and weatherization modifications. Eligible work includes roof replacement, windows and doors, repair of unsound structures, and other work needed to fix health and safety concerns. Wells, septic tanks, and replacement of faulty plumbing are covered by the Indoor Plumbing Program. With the Lead Hazard Reduction Program, homeowners lessen the risk of lead poisoning by reducing and eliminating lead-based paint hazards. These loan funds are available to limited income families, and interest rates are based on household income and the ability to repay. Payment-free mortgages may be available to households with low income. The Housing Department will assist you with the application process, contractor selection, and make sure the improvements are completed safely and efficiently. For more information, contact the Frederick County Department of Housing.
I'm Frederick County Executive Jan Gardner. From the shores of the Potomac River to the foothills of the Catoctin Mountains, with all the farms and bustling communities in between, there's truly something for everyone in Frederick County. Come and explore Frederick County's rich history and be part of our bright future.
And now here's this month's Medical Myths. This month's Medical Myths is about flu vaccines. I have covered this before and thought that everyone would have heard and understood the facts about the seasonal flu vaccine, but just today I heard someone state the most common myth. The most common myth is that the flu shot can give you the flu. No, a flu shot cannot cause flu illness. Flu vaccines that are administered with a needle are currently made in two ways. The vaccine is either made with, one, a flu vaccine virus that has been inactivated and is therefore not infectious, or two, with no flu vaccine viruses at all, which is the case for what's called recombinant influenza vaccine. The most common side effects from the influenza shot are soreness, redness, tenderness, or swelling where the shot was given. A low-grade fever, headache, and muscle aches may also occur. Studies using saltwater injections instead of flu vaccine demonstrated no difference in the report of those symptoms. A related myth is that the nasal flu vaccine can give you the flu. The nasal spray vaccine cannot give you the flu. The viruses contained in the nasal spray flu vaccine are attenuated, which means weakened, which means that they cannot cause the flu illness. These weakened viruses are also cold adapted, meaning that they are designed to only cause mild infection at the cooler temperatures found within the nose, not deeper into the lungs. These viruses cannot infect the lungs or other areas of the body where warmer temperatures exist. The nasal spray is well tolerated, and the most commonly reported side effects are mild and include runny nose, nasal congestion, and cough. If someone does develop flu-like symptoms after being vaccinated against the flu, there are several biologic or scientific reasons for that. One reason is that some people can become ill from other respiratory viruses besides the flu, such as rhinoviruses, which are associated with the common cold, cause symptoms similar to the flu, and also spread and cause illness during the flu season. The flu vaccine only protects against influenza viruses, not other viruses. Another explanation is that it is possible to be exposed to influenza viruses, which cause the flu, shortly before getting vaccinated or during the 2-week period after vaccination that it takes the body to develop an immune protection. This exposure may result in a person becoming ill with flu before the protection from the vaccine takes effect. A third reason why some people may experience flu-like symptoms, despite getting vaccinated, is that they may have been exposed to a flu virus that is very different from the viruses the vaccine is designed to protect against. The ability of a flu vaccine to protect a person depends largely on the similarity or the match between the viruses selected to make the vaccine and those spreading and causing illness. There are many different flu viruses that spread and cause illness among people. For more information, please see the CDC's website. And now, here is this month's health tip with Amber Nally.
Hello, this is Amber Nally, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Behavioral Health Services Division. According to the Centers for Disease Control and Prevention, suicide is the second leading cause of death for youth 15 to 24 years of age, and the third leading cause of death for 10 to 14-year-olds in the United States. Recently, a panel of national and international experts convened with the goal of determining what changes immediately preceded suicide attempts or death. The experts are now putting forward a list of warning signs that a young person might be at risk of suicide. These warning signs include talking about or making plans for suicide, expressing hopelessness about the future, displaying severe, overwhelming emotional pain or distress, showing worrisome behavioral cues or marked behavior changes. Specifically, this includes significant withdrawal from or changing in social connections or situations, changes in sleep, anger or hostility that seems out of character or out of context, recent increased agitation or irritability. Some characteristics are associated with an increased risk of suicide, such as having a mental illness including depression, conduct disorders, or substance abuse, having a history of suicide attempts, struggling with feelings of hopelessness, shame, or guilt, environmental risks including presence of a firearm in the house, situational crises, traumatic death of a loved one, physical or sexual abuse, family violence. Many suicidal teens demonstrate actions or behaviors that signal their suicidal intentions. Some teens may direct or indirect suicidal statements, write a suicide note or plan. If you notice any of these signs in anyone, you can help. Ask if they are okay or if they are having thoughts of suicide. Express your concern about what you are observing in their behavior. Listen attentively and non-judgmentally. Reflect on what they share and let them know they have been heard. Tell them they are not alone. Let them know there are treatments available that can help. Guide them to professional help. Remove any means for self-harm and seek help. During immediate crisis, call 911. Thank you for tuning in to this month's health tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.